Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. The medical profession is collapsing, completely collapsing, and we are going to see enormous changes over the next 10 to 20 years. And I think a lot of these changes are sorely needed. Now, I was having an interesting conversation the other day with some doctors, and the topic of nurse practitioners and physician assistants came up. And what I was hearing was that doctors were feeling threatened by NPs and PAs. Now, I've stated my views on this clearly before in a previous video. I think nurse practitioners and physician assistants are an outstanding addition to the clinician workforce, and they are clearly needed because doctors are not meeting demand and there are enormous gaps in healthcare. So we do need additional clinicians, whether or not they have a traditional medical degree. Anyway, these doctors were feeling very threatened and saying that nurse practitioners and physician assistants were doing a lot of the work of doctors and things were really changing and doctors were losing a lot of prestige, autonomy, etc. And I can tell you this, a few years ago, I would have had a lot of sympathy with that viewpoint. I would have thought, yes, doctors work so hard to get to where they are, and they deserve to be compensated well. They deserve various perks of the job, whatever they are. There really aren't too many perks when you compare being a doctor with other corporate equivalent jobs. But anyway, I would have had a lot of sympathy with that point of view that, yes, let's protect the profession as much as possible. Fast forward to today, and my views have completely changed as my eyes have been completely opened to what healthcare has become and how the medical profession has surrendered completely the traditional practice of medicine, and doctors have nobody to blame but themselves. Is every doctor responsible for what's happened to healthcare? Absolutely not. But the medical profession as a whole has completely sold out. We've had terrible leadership, and really doctors today kind of deserve what the medical profession is going to face over the next 10 to 20 years. Because let's think about this, doctor leaders everywhere have made medicine more about themselves than about the patient. The patient comes a distant second, or even third, or even fourth. Let's take the United States and United Kingdom, two very different countries in terms of healthcare systems, but doctors behave in a similar way. In the United States, you have huge physician lobbying power of various different specialties. Some specialties are obviously more powerful than others, but it's always about trying to maintain maximum compensation. How will any doctor maintain a certain salary, preferably increase it? That is their number one goal, and collecting as much money as possible within their coffers. I'm talking about physician societies. In the United Kingdom, let's take the National Health Service. Now, doctors in the United Kingdom, if they hear this, may not like it, but really, when you look at the situation over there, what's happened over the last few years with strikes, etc., I know that the superficial facade is all about, yes, we want to keep our treasured NHS and we want to deliver great care. It's all about the patients. But is it really? Because actually, if you look at the demands of doctors, number one is always pay and working conditions for themselves. The patient comes a distant second. Doctors, and of course this could apply to any profession, most professions out there are like this, they become self-serving and they become a gravy train. But when we're talking about doctors, we're talking about the health of a nation that is at stake. Look what's happened with healthcare over the last 20 years. It would be one thing if doctors were behaving this way and wanting to protect their sacred profession, if healthcare was actually improving. But look at what's happened. Everybody out there has an experience and a story to share. You can't find a primary care doctor in your area. It's almost impossible to get GP appointments in various different locations in the United States and United Kingdom. Every single year, people get sicker. Chronic diseases are soaring. Costs are skyrocketing in the United States. Many people go bankrupt every year because they can't afford healthcare. Outcomes are getting worse and life expectancy is falling. So you tell me, if by all of these metrics, healthcare is failing, the medical system is getting worse, people are finding it more difficult to get care, then why do doctors deserve to have their quote unquote prestige maintained? Why do they deserve to have their relatively decent salaries maintained when everything is getting worse? What is the logical argument for that? That they've studied a long time to become doctors? That doesn't quite cut it for me. Does it cut it for you? It should all be about having a good system. You take the average physician society in the United States, it's entirely self-serving. Go to any doctor conference and go into their exhibit hall, and you will find who is sponsoring that physician organization. Big business, big pharmaceutical companies, big pharma, millions of dollars every year. Why would the Physician Society be loyal to anyone else when they are being funded by big business interests? It is a complete and utter sellout. So I want to focus on three particular ways that healthcare and the medical profession is going to find themselves in a very different place within a few years. Number one, artificial intelligence, AI. I know that's become a very commonly used term nowadays, and a lot of people don't understand what it means, but the implications for healthcare are enormous. And most doctors right now are sleepwalking. They do not understand how artificial intelligence is going to completely change the practice of medicine. Diagnosis, management, the way patient records are analyzed, the way that their results are analyzed, it's all going to change with artificial intelligence. Entire specialties might be completely replaced. Can anyone tell me a logical argument why a computer can't look at a scan better than a doctor? Traditional radiologists are going to be in trouble because there is no way that once we make good artificial intelligence, a computer won't be able to read a scan much better than the human eye. You might have a human eye overseeing it, but I do not see any circumstances by which a computer won't quickly overtake a human. That is coming up very soon. Number two, the explosion of nurse practitioners and physician assistants, NPs and PAs. As I already mentioned, this is an area that a lot of doctors are finding threatening right now, but we need extra clinicians at the front lines, and my own personal experiences of nurse practitioners and physician assistants have been overwhelmingly positive. They are very smart, they are dedicated, they often have more time with patients, and whether I've communicated with NPs or PAs as colleagues, or even when I've met them at conferences, or I receive emails and messages, my own personal experience has been very positive, and I am tremendously happy that nurse practitioners and physician assistants are working with us at the front lines, and they will continue to do more and more of the work that traditionally doctors used to do. And I don't think that this will be confined only to North America. It's already happening in the United Kingdom and many countries in Europe. Why train a doctor for so many years when a nurse practitioner or physician assistant can be trained to do the same work? I do not accept the argument from some doctors that you need these excessive levels of training to perform basic functions. I do not believe that, and I know that policymakers in various countries see it the same way. Doctors cannot hold on to doing work that can be done easily by other professionals. And number three, you, the general public. You are the ones that will initiate big change within the medical profession. You will shake things up. I really sense that we're reaching a tipping point in many countries, United States, United Kingdom, for different reasons in different systems. But I feel like the general public has had enough. Every year in the United States, for example, healthcare insurance keeps going up and up. People keep getting less and less of a service. It's harder and harder to get appointments. In the United Kingdom, even worse, almost impossible to get good care and follow up quickly in many circumstances. And all people are seeing on the news is how unhappy doctors are, how they're demanding more pay, better benefits, etc. in a failing system. How long do you think it is realistically before the general public turns on the medical profession and says, hold on, you are the doctors here. Every year our healthcare is getting worse. When are you going to step up? In an ideal world, doctors should be steering the ship, making healthcare better. That is not happening by any stretch of the imagination. I think in many countries, public support for the medical profession is wearing quite thin. So those are some ways that I foresee big changes within the medical profession ahead. I'm a doctor myself. Once more, this is not an attack against any one doctor, but I believe the medical profession has completely sold out, and they totally deserve what is about to come to them over the next few years. And if any doctor out there thinks they can shield themselves from these changes, well, good luck to you, because you are absolutely not going to be able to do that. Big change ahead. Better brace yourself for that. Thanks everyone for watching. Feel free to comment down below. Check out my website and my free downloads. Those links are down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again very soon.